Enlarged prostate medication can sometimes affect sexual function, leading you to feel changes. If you've recently started taking medication for an enlarged prostate and notice a decrease in semen volume, this could be due to alpha blockers. There's no need to be alarmed. Welcome back to our channel. Today I'm discussing the prostate and its impact on sexual function. The prostate is an organ that wraps around the point where the bladder opens into the urethra, producing about a third of the semen and assisting in its discharge. It also encompasses the urethra, through which urine and semen from the seminal vesicles and sperm from the vas deferens pass. It's as if two highways merge at an interchange within the prostate, making it a dual-function organ, both urinary and reproductive. The importance of the prostate to men is quite clear, which is why understanding prostate disorders that can affect sexual function is valuable. One common condition is an enlarged prostate, typically starting around the age of 60. Statistics show that about 6 in 10 men in their 60s experience this, increasing to 7 in their 70s and 8 in their 80s. However, theories from 10 to 15 years ago are outdated. Now, it's suggested that men in their 40s should be conscious of prostate health, especially since a nutrition-rich diet or a preference for meat can accelerate its growth. Modern American society's nutritional abundance may be stimulating this growth, even increasing cases among men in their 40s. So how does an enlarged prostate affect sexual function? Directly, it doesn't. It doesn't act on male hormones or cause inflammation. However, medications for an enlarged prostate can make you feel like your sexual function is being affected. When the prostate enlarges, it compresses the urethra, making urination difficult. Medications used to relieve this compression are called alpha blockers. One particular alpha blocker, with the active ingredient tamsulosin, can cause semen to flow backward into the bladder instead of exiting through the urethra, a condition known as retrograde ejaculation. This results in semen being expelled during urination, making the urine appear cloudy or sticky. You might wonder if switching alpha blockers would help. While different alpha blockers vary in strength and side effects, those causing retrograde ejaculation generally have fewer dangerous side effects and are considered safer. Not everyone experiences ejaculation disorders with these drugs, which remain widely prescribed. Initially, I often recommend these medications to patients with an enlarged prostate. Without knowledge of these potential effects, someone might wrongly assume their sexual function has declined due to the prostate condition or medication, leading to unnecessary concern. Some may even stop taking the medication altogether and discourage others from using it based on their experience. If you've recently started on such medication and notice a sudden decrease in semen volume, it's likely due to retrograde ejaculation caused by alpha blockers. Don't be alarmed. Don't stop the medication abruptly. Instead, consult with your doctor about possibly changing the medication. For most patients, symptoms return to normal with a different prescription. Prostatitis is another common condition affecting the prostate, said to affect 1 in every 2 men at some point in their lives due to its prevalence. Symptoms of prostatitis can vary widely, from a stinging sensation during urination to noticing a slight discharge on underwear each morning. Other symptoms may include feeling like you haven't fully emptied your bladder, a heaviness in the lower abdomen, or pain on one side that may switch to the other side the next day. The area between the scrotum and anus, known as the perineum, might feel unusually heavy or uncomfortable. Some men may find blood in their semen or feel discomfort after ejaculation. Pain during an erection is also a common symptom of prostatitis. Prostatitis can cause various symptoms, and while some men may experience only one, others might suffer from several. The condition can sometimes be resolved with a 2-week course of medication, but for others, it may persist longer, requiring visits to multiple specialists known for treating prostatitis. This inflammation can impact the nerves that run from the spine, wrap around the prostate, and continue to the manhood. When the prostate is inflamed, it can affect these adjacent nerves, potentially leading to decreased erectile function. A reduction in erection strength can cause distress during sexual activity, possibly leading to premature ejaculation. If you find yourself with symptoms such as hematospermia, blood in semen, ejaculatory issues, or post-ejaculatory discomfort. Reducing the frequency of masturbation and sexual activity can be beneficial. Allowing about a month of abstinence helps give the prostate a rest since it's involved in semen expulsion. It's similar to wearing a cast to immobilize a broken arm to prevent movement and facilitate healing. Additionally, alcohol can exacerbate prostatitis. If diagnosed and undergoing treatment, it's advisable to avoid alcohol to aid recovery. So, what can be done to minimize the risk of prostate disorders? The answer often lies in appropriate exercise. An enlarged prostate is typically influenced by male hormones, specifically when testosterone converts to DHT, dihydrotestosterone, stimulating prostate cell growth. Lack of exercise can impede pelvic blood circulation, causing hormones produced in the testes to stagnate in the pelvic region, which in turn stimulates the prostate unduly. Regular exercise not only indirectly helps prevent enlargement but also plays a significant role in reducing non-bacterial prostatitis, which is far more common and often associated with prolonged sitting. Therefore, emphasizing exercise is crucial in managing prostate health. In our next session, we'll explore how chronic adult diseases impact sexual function in more detail. Thank you for tuning in, and I look forward to our next discussion. Thank you.